Stereotactic body radiation therapy, or commonly referred to as SBRT, is an ablative radiation technique, meaning we give very high doses of radiation over a very short period, typically in 5 treatments or less. Traditionally, this treatment has been used very commonly in the CNS for both benign and malignant conditions, typically given in one fraction. In more recent years, it's expanded to being used for early stage lung cancer and oligometastatic lung cancer, oligometastases to the lung with a great deal of success. And the toxicity profile for both use within the central nervous system and in the chest, in the thorax, in the lung has been pretty well described with prior studies. In recent years, this type of radiation therapy is becoming more commonly used for both hepatocellular carcinoma and oligometastatic disease to the liver, particularly in patients with colorectal cancer with liver metastatic disease. However, the toxicity profile of this treatment is not as well described, particularly toxicity to the chest wall, which would consist of significant chest wall pain requiring analgesic medications, or even a more severe later reaction like a rib fracture, which actually has been well described for patients undergoing SBRT to the lungs. So the purpose of this study was to try to assess predictors of development of rib fractures in patients undergoing SBRT to the liver. So we actually studied 283 patients. Roughly 2/3 of them were being treated for hepatocellular carcinomas that were inoperable, not surgical candidates. The other third, approximately 1/3, were patients with metastatic disease, most commonly from colorectal cancer. Treatment was typically the most common dose schemes that we use for HCC, usually 40 gray delivered over 5 fractions.